our favorite show, Marty Moose.
Clark Griswold. Father.
Oh gosh, oh golly, oh gee. S is for Super Swell Family Glee. E is for everything you want to be.
Husband.
M-O-O-S-E.
And attention deficit hyperactivity disorder sufferer.
That's me!
Attention deficit hyperactivity disorder is called ADHD. Generally, ADHD is diagnosed in childhood, and symptoms must be present before the age of 7 for an accurate diagnosis.
How'd you do at the tables last night?
I'm about even.
We do not have information regarding Mr. Griswold's behavior prior to 1983. However, we have been able to observe Mr. Griswold for 14 years, from age 38 to 52.
Russell, I never want to hear those words out of your mouth again. Gambling is a very serious business.
Is that clear?
Excuse me a minute.
He has shown very little improvement throughout that time.
$50 on black, please.
Come on, bets. Red, 25. Red win.
ADHD is 2 to 4 times more likely to occur in males than females. Additionally, it is more prevalent in North America. Mr. Griswold lives in Chicago, Illinois.
Shall we?
According to the DSM-IV-TR, in order to diagnose a patient with ADHD, one of the 3 core features of the disorder must be present.
What a magnificent achievement.
Clark, this is a family vacation. Could you try to stay with the family?
Sorry.
The 3 core features are inattention, hyperactivity, and impulsivity.
Welcome, everyone. I am your damn guide, Arnie. Now, I'm about to take you through a fully functioning power plant. So please, no one wander off the damn tour. And please take all the damn pictures you want. Now, are there any damn questions?
Yeah, where can I get some damn bait?
Eddie.
This way, please.
Mr. Griswold displays all 3 of these features.
This way.
Don't worry about the water leaking through the rocks, folks. It's perfectly normal. Please keep up with the
Mr. Griswold has had symptoms both at work and at home, which satisfies the DSM-IV-TR requirement that a patient has symptoms in 2 or more settings.
Audrey, come here. Give me your gum.
Out of my mouth?
I don't care, any gum. Just give me some gum. Look what's happening here. Just I'll catch up.
It also requires that Mr. Griswold demonstrate significant impairment over a 6-month time. Mr. Griswold has been noticeably impaired for more than 14 years.
Oop.
An ADHD diagnosis requires that symptoms cause a problem with everyday life. Mr. Griswold is obviously impaired in many situations.
Ellen? Russ? Where the hell is the damn tour? Oh boy, oh boy. Will you just take it easy, Ellen? I'm in complete control.
We must also categorize Mr. Griswold into one of 3 ADHD subtypes: predominantly inattentive type, predominantly hyperactive impulsive type, or combined type, which includes features of both the inattentive and hyperactive impulsive subtypes.
All right,
Thank God we're all right.
Clark, we're stuck under a truck.
Do you honestly think I don't know that?
Come on, you guys, don't fight.
Ah, for Christ's sake, I didn't do this on purpose.
Mr. Griswold meets 8 of the 9 criteria for the predominantly inattentive subtype.
And forgive my husband. He knows not what he does.
Amen.
He presents with some hyperactive impulsive type symptoms, but he does not have enough for a formal diagnosis of the combined type.
Made pretty good time.
Mr. Griswold has presented with predominantly inattentive subtype for 14 years. The symptoms appear to be disruptive and inappropriate for his level of development.
I was just smiling. I was just browsing.
Your wife?
His symptoms include failure to pay close attention to details.
What? What happened? Woof.
Careless mistakes.
I guess wouldn't be any. Oh. Wouldn't be the Christmas shopping season if the stores were any less hotter than they are. Whew, it is warm in here.
Well, you have your coat on.
Yes. Oh, do I? How did that happen?
Because it's cold out?
Yes. It is. It's a bit nipply out. I mean nippy out. What did I say? Nipple? There is a nip in the air, though.
Can I take something out for you?
And failure to listen when spoken to directly.
We're gonna have the best looking house in town, Russ. I've always wanted to do this.
It's a lot of lights, Dad.
Yeah, well, I'm sure it's a lot of work too, but if I'm out in the cold and I'm committed to decorating the house, I'm gonna do it right, and I'm gonna do it big.
Mr. Griswold often has trouble organizing activities.
Yeah, I guess so.
Sure you do.
I think you might be overdoing it, Dad.
Russ, when was the last time I overdid anything? Come on, unravel these. You have to check every bulb. Whoops, got a little knot here. You work on that.
He often does not follow instructions and fails to finish chores or duties in the workplace, not due to oppositional behavior or failure to understand instructions.
Audrey?
She'll see it later, honey. Her eyes are frozen.
Most enduring traditions of the season are best enjoyed in the warm embrace of kith and kin.
He often loses things needed for tasks and activities, such as tools.
Dad, did you bring a saw?
Audrey, come here, you gotta see this.
He is often easily distracted.
Daddy! Help! Daddy, I'm stuck! Daddy!
Vegas.
Mr. Griswold's final symptom is he is often forgetful in daily activities.
Hey, look, everybody, I think you're gonna want to see this.
To support the diagnosis of ADHD, the symptoms must not be better accounted for by another disorder, such as a mood or anxiety disorder. Mr. Griswold does not appear to have any other disorder that accounts for his symptoms.
Oh, don't worry, Audrey. It won't leave a permanent line.
Come on. There's a lot to do.
However, on his trip to Las Vegas, he lost his family's money and home while gambling. He should be monitored for other signs of pathological gambling.
Forget blackjack. If you want to really make money in a casino, walk walk up to a baccarat table and say, I want to play baccarat. Or use the French
You
pronunciation.
feeling lucky tonight, Sparky?
Not right now, honey. They're teaching me baccarat. I'm learning baccarat. Bet with the player.
It's not exactly what I had in mind.
Bet with the bank. Bet with the bank. Bet with the player. 9 is a natural. Bet with the bank. Bet with the player. 9 is a natural. Bet with the bank. Bet with the player. 9 is a natural. Bet with the bank. Bet with
Clark!
8 is a winner. Or, honey, sweetie, do you think we really ought to be doing this before we get married?
This is
Hard 6 coming out.
What?
Hit me. Ow. Night, honey.
Hey, I'll see you.
no.
Have a good time. All righty.
Rusty. Ellen?
Good luck, sir.
Due to Mr. Griswold's age, he may be more properly classified as having Adult Attention Deficit Disorder, or AADD. About 70% of children diagnosed with ADHD continue to have symptoms in adulthood, as seems to be the case with Mr. Griswold. Additionally, 50% of people with ADHD pass it along to their children. Mr. Griswold's children, Rusty and Aubrey, should be monitored for signs of ADHD.
What's been driving me crazy, Dad?
What?
Those goddamn baccarat tables.
Larry
They say
can
the
bend
player
his
only
leg
has a
up over his
2%
head
chance
without
when he bets
falling
with the
down.
betting.
Wanna see?
But I say, what the hell? You're gonna tell us what they're
That's
writing
your
in the
writing
books?
wear.
Because if those guys
Isn't it
go to bust
lovely?
outs, you think they'd be at home writing? Right?
All of you come with me now. Not you. Now listen, I know we haven't seen a lot of each other lately, and that's okay. But we're the Griswolds, and we're on vacation, and starting right now, we're gonna have a great time.
The best course of treatment for Mr. Griswold can be determined in a structured or semi-structured clinical interview with him and his family. A clinician may recommend behavioral therapy along with one of the FDA-approved stimulant medications to relieve the physical symptoms.
I mean, you know.
Ellen, I know what we can do. We can get remarried right now. There's a honeymoon slots tournament over at the Golden Nugget, and guess what? Newlyweds get in for free.
I've got news for you, Clark. I haven't said yes yet.
The FDA-approved medications are Ritalin, Cylert, and Dexedrine. Cylert has unpredictable and sometimes severe side effects, so he would probably be prescribed Ritalin or Dexedrine.
Invited you.
You find that Clark Griswold I'm married and tell him I'm at the Mirage. Come on, kids.
Don't worry about me. I got plenty I can do on my own in Las Vegas.
Behavior therapy may help improve Mr. Griswold's social skills, modify his behavioral deficits, and reduce his aggression. Throughout the years, Mr. Griswold has wanted to have fun, exciting trips with his family. With the proper diagnosis and treatment, he can accomplish that goal.
Take a ride on the West Coast kick. Holiday Road.